Good morning, everyone. Bom dia a todos. Let's start the session by remembering a beautiful song by John Lennon. Imagine. Imagine a world where the deadly grip of cigarette is loosened. Imagine a world where lives are no longer sacrificed on the altar of smoking-related illnesses. A world where people addicted to harmful product are given the choice to replace their addiction with a safer alternative. You may say I'm a dreamer, but I'm not the only one. And this vision is not a distant utopia. It's a reality that one country in the world is progressing towards. That country is Sweden. Today, I have the great privilege of unveiling a new chapter in the fight against one of the most intractable health problems. My name is Castro, and before I get into the details of why we are here today, allow me to introduce to someone, probably the first man I loved. This is my father. His name is Antonio, and he's 80 years old. He lives in Bahia. Like most men of his generation, he has overcome many challenges in his life. But there is one challenge that he hasn't been able to win, one that has plagued his health and haunted our family: cigarettes. Like the 20 million others who smoke in Brazil, for most of his life, my father has lit cigarette after cigarette, and with every puff has been dancing with death. His addiction has not just been a personal struggle. It has cast a shadow over our entire family. It has also meant that my father has never visited his granddaughter and I in England, where I've been living for the past 20 years. He cannot bear the thought of going through an airport where he cannot smoke, let alone get on a plane. It's absolutely heartbreaking. This gentleman, it's Sven. He's also 80 years old. He lives in Stockholm. Like most men of his generation, he also had an addiction to nicotine, but he chose to switch from cigarettes to safer alternatives because, unlike my father, he had the choice to do so. Unlike so many other countries in the world, Sweden has adopted a progressive and comprehensive approach in the fight against smoking. It's an approach that combines smoking cessation and prevention measures with policies that enable people who smoke to choose alternatives instead. Safer alternatives include snus, Sweden's most famous oral tobacco product, as well as e-cigarette or vapes, and oral nicotine pouches. They have based their policy on what we call the 3As. Sweden has made those products affordable, accessible, and acceptable. As a result, millions of Swedes, young and old, have made the choice to leave cigarettes forever and switch to safer products. My father never had that choice. Neither do 20 million people here in Brazil who continues to use cigarette, because current policies have left them behind. We are here today because we believe that everyone, not just a privileged few, should have access to alternatives. They are less harmful for their health, as we believe that nobody should be left behind. And that is precisely why we are here, because there are solutions that are within our reach. For centuries, people have smoked. And for decades, governments around the world have tried to get people to stop smoking. But today, smoking rates remain high. The World Health Organization says around 1.3 billion people continue to smoke. We cannot keep trying the same policies over and over again and expect a different result. What we can do is to embrace pragmatic policies, just like Sweden did. Harm reduction as a concept has been saving lives for decades, from the introductions of seatbelts to bike helmets, from condoms to child-proof packaging. As a society, we find ways to reduce the harm of potentially dangerous activities. We've done this because we have recognized that it is impossible to eliminate the harm altogether. Tobacco should be no exception. It's easy to say that people should quit. And yes, they should. But sometimes they cannot. Sometimes it's simply impossible. Nicotine is addictive, but it's not what causes all the harms we know are associated with smoking. Smoke-free alternatives such as vaping products, nicotine pouches, and snus have been scientifically proven to be far less harmful than smoking. Since Sweden has embraced these alternatives, the shift in the country has been drastic. And the evidence is clear. Sweden will be the only country in the world to be officially smoke-free when its smoking prevalence falls below 5% later this year. Looking across to Europe, you see that smoking rate is 5 times higher than Sweden's. As a result, Sweden's incidence of cancer are 40% lower than the rest of Europe, which means nearly 40% fewer cancer deaths. In nearly every other country in Europe, tobacco-related deaths are at least twice as high as Sweden. Research shows that if other EU countries followed Sweden's path, around 350,000 lives could be saved each year. It's just not European nations that can replicate the Swedish success story. Today, we'll hear from a Smoke-Free Sweden campaign that will show that 1.3 million Brazilian lives could be saved if they replicated the Swedish experience. We also hear from leading public health experts, politicians, and consumers advocates from around the world who will speak to the life-saving potential of Swedish-style policies, which brings me to why we are here today. Today, I am honored to be officially launching Quit Like Sweden. Quit Like Sweden, or QLS for short, is a platform with very big ambitions. The platform will encourage, will assist, and enable other countries to recreate the Swedish experience. Making people aware of the Swedish success isn't enough. It's vital that countries recreate the Swedish experience and get the same results as Sweden did by adopting a comprehensive approach to tobacco control. That means the familiar cessation and prevention measures must be complemented by policies that enable smokers to switch to other alternatives. Quit Like Sweden will enlist international experts to the cause, and this platform will serve as a support whenever anyone, anywhere is considering reducing smoking rates. Quit Like Sweden will be a hub for all stakeholders, from policymakers and governments to NGO, the media, to understand how Sweden has achieved the success and what they can do in their countries to fulfill the same mission. Because at the heart of Quit Like Sweden, there is a mission. A mission to one day make smoking history. A mission to give smokers, like my father, regardless of where they live, the hope that one day he's just not going to be another sad statistic. A mission to implement regulatory frameworks that are within our reach, that will benefit millions and millions of people around the world. That is why we are here today. That is why I'm proud to launch Quit Like Sweden. Thank you, obrigada, and welcome again.